Caring for patients with acute and chronic liver failure in the ICU is particularly challenging. These patients often present with multiple organ failures that can include respiratory failure, coagulopathy, and these patients also are at increased risk of infections. They are very fragile and their condition can deteriorate very fast. So early recognition and monitoring is crucial for these patients. One of the most difficult aspects is prognostication, trying to determine which patient will actually recover and which patient will need to go into emergent liver transplant. That's why early, proactive discussions with transplant centers are necessary. Another important aspect is nutrition. Patients with liver disease are often malnourished and they often present with sarcopenia. They've lost muscle mass, but also muscle functions. And this puts them at higher risk for complications that can include more encephalopathy, ascites, more infections, but also they are at an increased risk for mortality on the transplant wait list, but also after liver transplant. Malnutrition in cirrhosis is quite complex. It's driven by poor intake, malabsorption, increased protein breakdown, and often this is worsened by a state of chronic inflammation. When these patients become critically ill, their nutritional needs become even more pressing. That's why nutritional therapy is essential, but can be complex. We have to find the right balance. They typically have higher energy needs, but reduced tolerance to feeding. That's even more common in the context of critical illness. Nutritional therapy should be started early, should progress cautiously, and should take liver function into account. Protein intake is essential to prevent further muscle loss, though it might need to be adjusted during episodes of encephalopathy. Deficiencies in vitamin A, D, E, K, but also in iron and zinc are very common, and thus routine supplementation should be considered when they are in the ICU. Another key concern is infection. Cirrhotic patients experience immune dysfunction that makes them highly vulnerable. Even minor infections can lead to a deterioration. That's why early detection, appropriate antibiotic use, and source control are very important. In a secondary analysis of the URBAC2 study, we found that cirrhotic patients with bloodstream infections tended to be more prone to ESICM infections, and they had also a significantly higher mortality compared to patients that did not have cirrhosis. A last point to mention is that we do have to look beyond survival. Even when patients survive, the journey is not over. Many patients will face persistent fatigue, muscle weakness, psychological distress. And to truly improve outcomes, we must look beyond ICU discharge. Post-ICU follow-ups are thus crucial for monitoring complications, supporting functional recovery, and trying to restore their quality of life. Physiotherapy and nutritional support can make a difference in long-term outcomes. So today, for World Liver Day, we would like to share some key message with the ICU community. Every step counts for these patients, from early transplant discussions to nutritional support, infection prevention, and recovery planning. It all matters. And we must remember to look beyond the ICU. Long-term recovery deserves just as much of our attention. Thank you.